So today we're just going to talk about how to use this type of PEP device. We're going to talk about some indications, and we're going to also talk about some hazards of this type of therapy. PEP therapy is a vibration type of therapy that's used for airway clearance. When you do PEP therapy, just like any other type of therapy, you have to do a full assessment before and after the therapy with your patient. So what PEP therapy does is it is an exhalation type of therapy where you're going to breathe into this device, and the device is going to send vibrations down into the lungs, which is going to break up those secretions, move them to the larger airways so that they can be expelled. This device that I have is called the Coronet, and to use this device, what you do is you take a deeper than normal breath through the nose, and then you seal your lips around the mouthpiece, and you're going to exhale fully and completely through this device, which is then going to send that vibration back down into the lungs. Like I said earlier, break up that stuff, and we're going to kind of start moving it up and out. There are 4 different levels of resistance, which is determined by patient effort as well as comfort in the physician's orders. This device is to be used 15 times every hour by the patient. It is important to instruct them not to do a forceful cough, as the huff cough works much easier to get the mucus out of the bronchi and up into the larger airways. With this type of device, it does come with a T-piece, which can be used if your patient is having a little bit of trouble using this device. Some indications for this device are going to be patients that are having trouble getting those secretions up and out, and that includes patients that have excessive secretions. So that might be your COPD patients, it might be patients that have cystic fibrosis or something where they really need to get that up and out. Now, contraindications include pregnancy, hiatal hernia, aortic aneurysm, active hemoptysis, even nausea can be a contraindication for this device. As stated earlier, when you're finished with the treatment, you also need to do a full assessment of your patient. You may notice that lung sounds have gotten worse between the beginning of treatment and the end of treatment. In this situation, that is probably caused by those secretions moving up into the larger airways, and so that means your patient will be able to hopefully get that coughed up and out and be able to expel those secretions, which should increase those lung sounds. So that is how you use the Coronet.